Okay, this is a conference call with patients at Coalinga State Hospital. My name is Jeff Gamble. I'm your moderator. Today is May 9th, 2020. The subject is specific to wearing of masks and with staff and not wearing a mask. And also we've added another topic, which is the passing out of masks for patients and how that's being handled. I made two rather lengthy introductions for the conference call we had on April 25th and May 2nd, specific to the issue of that this is a management issue in terms of not basically imploring staff about the necessity of wearing these masks in terms of their health and the health of their families. There is a statewide email that was generated April 10th, 2020, to all DSH team members from the Office of Communications that they're required to wear their masks in all common areas, patient care areas, and in proximity to others. I think that's all I need to say today. Sam has been our first presenter on the last two calls. He was on a hunger strike. I think he has some news on that. So we'll go ahead and get started with our presenters. Each person has approximately 2 minutes. Sam, you want to go ahead?
Yeah. As of Wednesday, I was advised by counsel to discontinue my hunger strike. Brandon Price has changed the protocol. Anybody who goes out to medical and goes to, when they come back from their medical, they go to MA2, they go to isolation for 14 days. And I'm definitely not going to go to any isolation for no 14 days. That's one issue. So for the time being, I discontinued the hunger strike. And my lawyers are still working on getting me back to MA2, where I never should have left. So they're going through other avenues to get that done. Also, we're not happy about the mask. Nobody's been instructed on the mask properly. This is hospital-wide, actually DSH-wide. No patient has been properly instructed on these masks for patients on how to wash their own mask. This is ridiculous. How nobody has been properly instructed to just give the mask and that's it. I've had a lot of repercussions on from mostly DPS. They're not happy with me. They just don't like the way I've fronted them off. They've cussed me out on Sunday last week. Told me to go after myself. I asked them very nicely to put the mask on in the mall, and they told me to go after myself. And then in the package room, they won't help me at all. They told me to go call the chief. So that's my experience, but that's okay. I don't mind.
Sam, real quickly, two questions. What have you observed on your unit with compliance and wearing masks? And secondly, going to May 1 for isolation, as we understand it, that's basically solitary confinement. You don't take your property with you, and you're required to stay in an isolation room. I assume if you came... Go ahead.
I was told that, no, you're in isolation for 14 days. They got 3 people right now. You get a phone, they take you to phone, and that's it.
But you don't have any of your property, correct?
No property.
That's basically solitary confinement.
Right.
What have you observed on your unit with staff wearing their masks?
Much better. Much more improvement. I can only report my unit.
Okay.
I have no information on other units.
Okay. All right. Let's go.
The officers in the mall area, I haven't seen. But there's been improvement, but they shouldn't have an attitude when somebody asks them to put their mask on. They shouldn't get upset about that.
Okay.
They shouldn't.
All right. If you could go and maybe call some of the people that are missing. All right. Let's go to 1954. I know there was an incident last week. If you could address that.
Incident?
Yeah, there was an incident where we called the watch commander and there were 5 officers.
Oh, yeah. Nothing happened that day. Today I just walked around. There's 2 staff without masks and 2 cops with masks. But there's nobody else on the unit today.
Did the watch commander ever send an officer up to speak with you?
No.
Nobody ever came and talked to you, huh?
No.
Okay. And what have you observed? So that's all you've observed this week is what happened that day?
Like I told Sam, everybody, when they're in the bubble, they have their mask down, they're chit-chatting, except Lander. Everybody else either doesn't have a mask on or wears it down under their chin, and that's the way the program goes.
So when you told me last week, I forget what day it was, that there were 5 officers without masks.
There were. And it was only a couple days ago, and there hasn't been that many cops up there that I've been awake to see since then. But there was 5 cops in there with no masks on, chit-chatting, like it was a donut shop.
So when I called the watch commander and reported that there were 5, what you had told me, that there were 5 officers and that you were willing to speak to them, they never came up and talked to you.
Correct.
That's unbelievable. Okay. Okay, is that all you have to report?
Yeah, thanks, Jeff.
Okay. 7335.
Okay, things have not really changed much since last week. We still have the officers mostly not wearing masks except when they're out on the unit or out on the courtyard. We have several staff who have not used masks, and most of them do. I was down at the grill on Wednesday, and there was a sergeant in the grill who was not wearing a mask.
Is your phone on? Do you have your phone on speaker?
As far as I could tell.
Is your phone on speaker?
Yes.
Could you put it on? Could you take it off of speaker because we're having a hard time hearing you?
Is this any better?
Are you talking into the phone?
Is this any better?
Much better. Much better.
Okay, what do you need repeated?
Yeah, start from the beginning, please.
So things have not really changed much on our unit. The officers are in their bubble, as the other guy said, not wearing their masks except for a couple. I've seen a few staff, particularly when they go out on the yard and break, not wearing masks. But otherwise, most of the LOC do wear masks when they're out and about. I have not noticed them in the office much because I don't go down that often. When I was at the grill last week, there was a sergeant in there who was not wearing a mask. In fact, didn't even have one with him as far as I could tell. Seemed to be very comfortable in that situation.
Did you see what his name was?
Do I say it?
Did you see what his name was?
Yes, I did.
What was it? Huh?
Buster.
Buster?
B-E-U-S-T-E-R.
B-U-S-T-E-R?
B-E-U-S-T-E-R.
Oh, B-E-U-S-T-E-R, in the grill with no mask. Okay.
No mask.
All right. Okay. All right. Anything else you'd like to report?
One other point, I was at the computer lab on Wednesday, and none of the staff in the computer lab was wearing their mask, as far as I could tell.
And they were interacting with patients?
Well, remember, at this time there's hardly any patients. There's only 1 or 2 people in the whole lab.
Okay. But do patients then go and interact with them to make copies and turn in their thumb drives and that sort of thing?
I used my mask when I went up to the cage to make a copy, but the person in the cage did not. And I don't remember seeing the ones on duty out in the area, in the room, with their masks on.
Okay.
The one in the bubble, one in the cage, rather, was Rosalie Cano.
Okay. All right. Is that it?
I think so.
Okay. We'll come back for last comments from everybody. Okay, 50-50?
Yeah. As far as
you usually go last. Let me go to 4444. I apologize. Let me go 4444. I always do you last. 50-50. You're our closer. 4444.
Okay, yeah, it's getting better on my unit. For the most part, there's only a couple staff that don't wear their mask. I think they refuse to wear a mask when they're around patients. But when they're in their nurse's station, they don't wear the mask in the nurse's station. When they're around each other, they're not wearing their masks. The DPS officers, for the most part, when they're around us, they put their mask on. But when they're in their little bubble in their nurse's station, whatever that is, they put on their masks. I mean, they take off their masks.
And so, how close are they when they're real close to each other as well?
Yeah, they're within a couple feet.
Okay. All right.
I've had several nurses not wearing their masks.
Okay.
When they're around us.
And that would be while they're around patients?
Yes.
Okay. All right. These are serious violations in violation of the protocol for that's been spelled out in the email dated 4/10/20.
Last Sunday, right after I got off the conference call, they had a little bowling thing up here, and there was, it was last Monday, excuse me, it wasn't Sunday, it was Monday because there was staff members here. There were 2 staff members without their mask on and a nurse right in close proximity to patients they were bowling without their masks on.
Okay.
I mean, right in the hallway where the nurses' office is, where all the staff offices are, they were bowling in that hallway, and the staff were right there with the patients while they were bowling without their masks on.
Right. Okay. Is that it?
Yeah, that's it.
Okay. We had somebody come on. Did we just have somebody come in on the call?
Yeah, just me. I'm back.
Oh, Sam?
Yeah.
Okay. Do we have anybody else come on the call? Anybody new? Before we go to our last person, 50-50? Okay, 50-50, you want to go ahead? Okay, and I want to say one thing before you go 50-50 is that this is just really discouraging. I don't understand. This will be our 3rd week of conference calls. I want you guys to know that I do police reports after each call, and I will be calling the watch commander. I call chief of law enforcement. I'm just astonished. Are we taking this seriously or we're not? Go ahead, 50-50.
Okay. One of the things, and by the way, along with that, where you say it's an infraction, DSHC Administrative Director 801, which tells you the purpose of the Department of Police Services, and it says that they're supposed to enforce the state laws, the federal laws, and the hospital policies. So, yes, that's what they're supposed to do. And the fact that every single employee that works for the state, actually every single government employee going down to the janitor is a mandated reporter. So they are required by law to report these incidences, and the lack of safety. So, yeah. But as far as it goes, it has improved some. As far as the staff wearing the mask, we do have staff that still don't. At this particular day, most of the staff on the unit, I'm on an ICF, so we've got a total of 7 staff. That's going to be 6 psych techs and 1 nurse. And more than half of them are from other units, and not even other units in my wing of the hospital. They're from other programs. They're from the other side of the hospital. So if they're worried about us mixing together, they're mixing together from different programs, different things, and they're not, and a lot of those people are not wearing their mask, and especially not when they're talking to each other or sitting next to each other with the computers. So also the other thing was able to look at their infection control manual, at least parts of it, and they're supposed to be doing things to protect us, not just wearing the mask. They're supposed to go in the common rooms like the day room, and every 2 hours they're supposed to wipe down the table, the microwave, the ice machine, the counters, the tables, the chairs, everything like that. They refuse to do that. only every once in a while will I see them wiping down the table and maybe a chair or two. They're also supposed to, like the bathroom stalls, wipe those down. I mean, the stall doors every 2 hours.
The staff
if they would be doing that, then they would notice that, like, one of the stalls hasn't had tissue paper covers for the last 2 days. But when we tell them about it, then all of a sudden they do have it. So it's just them not doing their job.
They're supposed to do that every 2 hours?
Mm-hmm. Every 2 hours, yes.
And that's every day?
Log that in the office. There's a log inside the bubble. They're supposed to sign that every 2 hours that they've done that.
And is that just because...
don't do it, that's a felony. That's falsification of state records.
Joel, is that is just during this certain enhanced period of time, or is that like 365 days out of the year?
When there's a medical like this, or infection control, with this, they fall under airborne and they follow droplet protection.
Yeah.
And that, just like with the doorknobs are supposed to be every 2 hours, so are all the common things that your hands go to. It's not just the doorknob, it's the doors themselves.
Wow. Huh.
Well, and that's supposed to be done by staff.
Yeah. Okay.
And
wow. Is that all you had to say, or was there anything else?
Well,
we're going to do a round robin here.
In the policy, in the administrative directives, it actually specific says in there, like the ice machine and the microwave, that it's supposed to be cleaned every single day. This is on a regular basis, and they're supposed to do the log just like they do the temperatures for the fridges, where they have to sign it. And it specifically says in there that staff is supposed to do it because they have access to stronger and more effective chemicals than patients can have in their possession.
Right.
That's one reason why staff have to do it, not the patients.
Right. Okay, we'll come back around and give everybody...
Sorry, one last thing is I still stand by my thing. If this is what you're trained in to deal with, germs and that, I mean, psych techs in the general public are the ones that are supposed to help people bathe and help. This is their career. If you're not going to do it, you're in the wrong profession, and you're causing more of a problem. It's a false sense of that it's being done, and you need to find a different profession.
Yeah.
Okay, thank you.
Exactly. We're going to come back around to everybody 30 seconds. Okay, Sam, you have a closing comment?
No, I'm good. Thank you.
Okay, Larry Lowe, closing comment? 1954. Sorry about that. 1954.
Yes. Hello?
Yeah, 1954, closing comment?
No, nothing from me, Jeff. Thank you. Everything Joel said, I'm 100% behind.
Okay.
I mean, 50-50.
44, closing comment?
Yes, about the cleaning of everything. We had an April meeting, and my U.S. said that if we want the staff to come around and clean everything, we can go to an ICF. That our staff didn't have time to be cleaning stuff, but it's their job. That's what they're supposed to be doing. And if they don't have time to do it, but they got time to come and search our rooms, that was another statement he said, that our staff are going to be searching 2 to 4 times a day, but yet they don't have time to go around and wipe our doorknobs and make sure our tables and stuff are clean, but yet they have time to search. DPS officer just walked by me just now, and he had his mask down. He didn't have it up.
Huh. Okay, 7335, closing comment?
Closing comment, a couple of things. If staff searches your room and handles your possessions, they're supposed to be changing gloves between each person. That's definitely not happening.
Mm-hmm. Okay.
Also, the comment before, we don't need to get behind people. We need to get in front of them. Let's lead.
Yeah. All right. Okay, did I leave anybody out, or anybody want to say something before we come to close this out? Okay. You guys, we're missing a few people. I know one person didn't feel well. I was sick myself yesterday. But let's plan to do this again next Saturday at 1:45. That way we get everybody together. I know a lot of people have issues with not starting on time at 2 o'clock. So please, man, I think it's important. Some things came out that I was not aware of, particularly this issue of cleaning that 50-50 brought out, and that 44 just mentioned in terms of an ICF versus an RRU. Let's see what we can find out about that during next week. As usual, I call the watch commander and do a police report on each one of these conference calls. And thank you, guys. We're going to wrap this one up, okay? All right.
Thank you.
Bye-bye.
Are these calls posted again or not anymore?